night, guys. Dani Williamson over here. It's Sunday night, and that means it's Sunday night service. And I am so excited tonight to have Dr. Jocelyn Strand on here tonight from Biocidin or Biobotanical Research, talking about the power of biobotanicals, just in general, their products, but biobotanicals in general tonight on healing the immune system, building your immune system, getting rid of the bugs in your gut, right? The bad bugs, building up your microbiome, all those things. I'm so excited to have Dr. Strand here. And guys, as soon as you get logged on tonight, hit your heart buttons, hit your like buttons. Whenever she's talking, I'll get us pulled up here on my phone. Tell us where you're from, and then post your questions up for us tonight, okay? So we are so excited. I've been trying to get these people on for a long time, and I'm going to tell you a little bit about Dr. Strand, then I'm going to let her take over talking about the power of their products. But she's a naturopathic doctor, which, you know, we don't have here in Tennessee. We're not, well, we can't have naturopathic doctors apparently. And it makes me so angry. She graduated from the top of the top of the top in naturopathic school, which is Bastyr University, in 2005. And she spent time after that. She stayed in the Seattle area. She worked at Pharmaca Integrative Pharmacy. Is that correct?
That's perfect.
Yeah. Primary care doctor. She also was in a GI clinic. And she worked with a rheumatologist. So right up my alley with everything that I do, which is gut and autoimmune. She's now in Minnesota, where she is she practiced as a primary care provider there, but now she is the director of education, clinical education and research for Biobotanical. Correct?
That's correct. You said it perfectly.
Okay, good. There we go. I didn't memorize it clearly. But if you don't know their products, man, you're in for a treat tonight. You're going to learn some things that guaranteed you did not know about the power of biobotanicals and what they do and the integrity of the company. You know, you don't know this, Dr. Strand, but because you don't know what I do and how I do things, but I am very particular when we bring people on here. You know, Microbiome, Karan's been on here. I mean, I'm very particular because I think you have to have such integrity when you talk about products, right? You just can't sell things to people. You've got to use these products yourself. And I use these products. My patients know I use this throat spray every single day of my life during this season right now. And the toothpaste and all. But let's get started, guys. As soon as you're on, let me know. Okay, we are live. So this is good. Dr. Strand, take it over. Tell us what you do. Tell us how you do it. And tell us about your amazing company that you're a part of over here, which I absolutely adore.
You're all prepared with all of the goodies.
I am. I love it all here today.
I've got my throat spray here too.
Oh,
so, you know, I love the way you opened the conversation, because the reason that I can work for this company and, you know, the reason that I was drawn to the company in the first place is because of their integrity and because of what I saw in my practice. Right. So my very first patient was a very, very sick little girl. She was 3 years old. Not my first patient, but my first patient with Biocidin. So this was about 7 years ago now. And she came in and she was very pale and gray, you know, dark circles under her eyes. I think I would kind of classify it as a failure to thrive. She was underweight, really not interactive. And she had this respiratory response where she was only eating about 6 or 7 foods at that time because she had so many allergies to foods. And after she had foods, just intermittently and unexplainably, she would have a respiratory response to the food. And it was silent. So her mom would come in the room and her daughter would be passed out on the floor, blue. And then it was ER, prednisone, you know, and this was happening weekly for this little girl. And her mom was convinced she wasn't going to make it to kindergarten. At the time, she was sleeping on the floor next to her daughter's crib because she was so worried, so anxious about her daughter's health. So here's me. It's like, as a practitioner, it's a nightmare patient, right? You're like, oh no, what am I going to do? Like this, I'm afraid I'm going to prescribe the wrong thing and she's going to react to it, you know, with all those allergies. And so what I decided to do testing, which we do often, but especially in a case like this, like I don't want to just shoot from the hip in a patient like that. So I ran a stool test that showed what was growing in her gut. And she had dysbiosis, or unbalanced growth of flora in the gut, including some yeast overgrowth, candida albicans, and she didn't have enough bifido. She had a few other bacterial pathogens as well. And I said to the lab, do you have a recommendation? I'd never treated pediatric dysbiosis. And she said, give Biocidin a try. So I ordered my first bottle, and we did 1 drop twice a day because she was so tiny. And I just basically crossed my fingers and waited, right? And she came back 3 weeks later, and she looked like a different kid. I mean, she was pink and bouncing around the room. She hadn't had another respiratory event since she started taking it. After a lot more sort of years of working with this patient, I then learned that she'd had mold exposure. She had tick-borne illness exposures. So the benefit to a botanical medicine like this one is that it covers a lot of different bases. And it was easy to use with a pediatric patient. This little girl was so sick, and it totally changed her life. In fact, I saw her about a year ago, and she's 11 now. And it's just so rewarding. It's why we do what we do, right? As clinicians, is that it's just, her mom is forever grateful that it totally changed her life. She couldn't even touch dairy without having an anaphylactic response to it. So her life is completely changed now, and that gets your attention when you're a practitioner. And then I was off to the races. So I tried it on myself, of course, and my family. And then I started using it really regularly in my practice. And then I met Rachel, Dr. Fresco, at a conference, and she was like a rock star to me because this product was so exciting for me. And I said, if you ever need anyone to talk about your product, please let me know. This is 5 years ago now. I started working a few conferences. And then as I've learned more about their products and their research, I've just become, it's really become a passion of mine to get this product to as many practitioners as possible so that they can help patients with this product. And of course, now talking directly to consumers today, I typically am educating practitioners. So this is fun for me to have direct access to consumers and to say, take this to Dr. Williamson and this information and work with her on it, because it's such a remarkable product line that you will never. I just think you won't be sorry. You'll be very thrilled with where it takes you. And we can talk. Should I talk about what the product is a little bit?
You bet. But we're going to say hello to my mom, because my mom lives in assisted living up in Kentucky, and she is watching live tonight with one of the nursing assistants there. So she just posted, said, "Hey, Mom.
Hi, Mom."
Yay! All right. And Tracy's
awesome
from Atlanta. So let's dig right in, guys. So get your notepads ready, because you're going to want to take notes on what we've got here.
Okay, perfect. So Biocidin is a combination of, and this is the flagship product. Thank you. Yes, I've got it right too. Here. And this bottle is almost empty because I'm in the midst of using it for a cleanse myself right now. So the Biocidin is a combination of 17 herbs and essential oils. So only 4 essential oils, 13 herbal extracts. And the beautiful thing for me about herbals is that they never have just one mechanism of action, right? They're never just working one way. They're working in a multitude of ways to support the body. Most often it's to support the body. And we're really designed to work alongside these. And so it's a really different thing from, forcing either a high dose single herb can do that too. But this is so gentle because all of those 17 are in such minuscule amounts, each one, that people tend to not react as poorly to it, right? And so it's much
right about that.
It's much easier to use. At the same time, it's very, very potent. So when people do react, I think it's typically what I saw in my practice is because they're reacting to the activity of the product, not to the product itself, right? And so they're reacting to the activity, which is a very broad spectrum antimicrobial activity. I just want to make a quick statement that none of this is meant as medical advice, and that I have to be really careful, and our company and everybody in this world right now needs to be careful about how we frame things. None of this is making a claim. And if you hear me sort of fumbling for words, it's probably because I'm trying to find a way that's safe to say to say something, right? That also gets the information to you that you need. And so please take everything I say in that manner. So that being said, it's very broad acting. We have a number of different research or case studies showing clearance or therapeutic effect on a number of different infective microorganisms. And that's one mechanism that we've studied. The second mechanism that we've studied is this ability to support immune system function.
Yes.
And it's a modulatory effect, meaning if your immune system needs support to increase, then we were able to show that in a clinical trial. And we'll talk more about that one, right? Because that's the throat spray. And I think that right now has the potential to be the most important product in the line for what's going on in the world right now.
Yes.
And then the third mechanism is the breakup of something called biofilms. And biofilms are something that's not really addressed, I don't think, as a sorry, that was a call coming in.
Oh, okay.
I'm sorry. So I just realized that I don't know how to stop my phone. I'm on my phone instead of my computer.
Okay.
We'll move along. So biofilms are the easiest way to describe them to me or help people understand them is that the plaque that grows on our teeth by the end of the day is a biofilm. And that means it's a cluster of microorganisms that are growing together. And once you have biofilms, and teeth are our main area of biofilms in a body, unless you have implants of some kind. But we can get them all over the body, and it's a cluster of more than 10 cells, and then they can reseed. So if you can work on with antimicrobials, even antibiotics. If you have biofilms and you don't address them, then you can get what's called refractory illness, or the disease will continue to come back and back and back every time you come off of the antibiotic or off of the antimicrobial. So these are the three mechanisms of action. There's the antimicrobial effect, the biofilm busting, and immune modulating. And that, the other thing about that is those are the three we've studied. Who knows how many other mechanisms there may be? We know that a lot of the herbs are antioxidant as well. And so there are other ways that it may be working. And we are researching some of those things too right now. So we have a number of different research projects underway currently.
Yes, you do. And I worked for a Lyme literate doctor for 5 years, and he used a tremendous amount of biocidin with Lyme disease and his autistic patients as well. He used a whole lot with Lyme disease for the biofilms and things.
Okay. Was he using the liposomal form of the biocidin?
Oh, gosh, that was 6 years ago. I don't know, but I'm going to discuss the two differences. Why would you use one over the other? Because this one I feel not so confident about. Okay.
Well, that's a great question. They're actually biocidin. So that's, the flagship product. There are only 10 products in the full line, and 6 of them have biocidin in it. And that's because you would select your product based on where your therapeutic target. So if you're in the mouth, you want the dentalcidin or the dentalcidin LS. If you're working in the gut, you want just the straight biocidin. And if you want to get outside the gut, then you want the liposomal biocidin. So a liposome is a technology that our cells recognize on our cell surface, the liposome, and it crosses. We actually did research on this with Borrelia, which causes Lyme disease, that the biocidin in the liposomal form crossed the cell wall of the Borrelia 74% better uptake than the liquid biocidin. And that's important because we have a whole slew of intracellular pathogens in the world, right? And we have pathogens that are outside of the gut. So, and what a pathogen is like a harmful microorganism. So if you're trying to reach somewhere outside of the gastrointestinal tract, I'll give you a couple of examples. So anything topical, right? So I can speak to somewhat what I've seen in my practice. Again, this is not a claim by the company, but what I've seen, and we have great case studies on plantar's warts or molluscum contagiosum, so these are things that I've seen. So for a topical application, fungally sorts of yeasty things, all of those things, the liposomal one would be the one that you'd pick, right? Because
I'm going to start this tonight on my son because he's had 20 plus plantar's warts taken off of his feet. He's only 24.
Oh my gosh.
And I just opened an Amazon package today, and it was wart spray. And I was like, what in the world? I don't know what it was. Anyway, and it's for Jackson. He must be having trouble with it again. So I am going to test it. We're going to do 1 foot with this then and 1 foot with whatever he ordered from Amazon. And we'll see what.
Take pictures. We'll publish a case study.
Okay, we'll do it. All right, guys, that's what we'll do. Who's got planter's warts? Okay.
Let us know how it goes. So
we use the liposomal for something outside of the gut. If it's in the gut, yes. If we're trying to build our immune system up in there or kill bugs or lower LPS or something like that.
Yes, exactly.
Use the regular biocidin, but if we're anything outside the gut.
Exactly. And so when you have a liposome, you hold it in your mouth for 2 to 3 minutes. It will absorb into the bloodstream and the lymphatics in the area. So if we want to get, anywhere outside, so anywhere outside the gut in this region too, right? So central nervous system or middle ear or sinuses, then we're looking more at the liposomal form. And so that's how I would think about it. If we think about kidneys and bladders and all of prostate, all of that stuff is outside of the gastrointestinal tract. You're going to get it. You would select this as a way to get to that target more effectively.
Can you use it topically as well?
Yes.
Okay.
Yes. And so the topical application is what we most often see for dermatological or skin conditions.
Okay.
It's intuitive, right? But oftentimes doctors will prescribe both oral dosing of the liposomal biocidin,
okay,
and the topical at the same time. So a case of a little guy, 14-month-old with molluscum. I'm going to close my window because I've got mottled face here.
But it looks beautiful. Your face looks much better than mine over here.
Oh, I don't think that's possible. So this little guy, we ended up we're actually working on publishing this as a case study right now as a company. We're hoping to get some of this published so that we can take it to the larger medical community with some sort of people just buy it. People are more likely to listen, and we're allowed to make more firm statements when we have published research, right? Which is why we're after that. And so, like I said, we can't say 100% or make a claim that this will take care of molluscum or plantar warts or anything like that. This little guy, molluscum contagiosum, is a virus that usually takes 6 months to 4 years to heal. And it's highly contagious, and it goes through daycare centers. And this little guy, his own tiny little body. He probably had at least 100 lesions on his trunk, on the front and the back. And he did topical and oral dosing. And we have pictures. We have all this sort of progressive pictures, and his were cleared in less than a month. His lesions were cleared, and so. Like I said, that was the experience that we had. We're working on verifying it. And we have another molluscum case study. We have 2 case studies already, and we're working on one more right now. And we're hoping to publish some of that stuff. So it's exciting to see. There's not much in the way, like for that child, there's no conventional therapeutic at all, because you can't burn 100 lesions off a 14-month-old baby. So it's just it's exciting when you see something like that happen. So,
and age-wise, what's the youngest we could use?
The biocidin products safe for babies from birth until all the way through the lifespan. The only contraindication is pregnancy.
Pregnancy.
We haven't studied it all for safety during pregnancy, and even we have. I'll give you another example. I know I keep talking about pediatric patients. There must be a reason, because it's just what's happening. But there's a doctor in Canada who's a naturopathic doctor, Dr. Matheson, and she came up to us at the ILADS, which is a big Lyme conference, a couple of years ago, and said that she was using the biocidin liquid, 1 drop twice a day. She cleared herpes simplex virus 1. Of a newborn case, HSV of a newborn that was causing seizures I can't say it that way. What I can say is that she watched this baby's symptoms resolve at the same time that she started using the product. So correlation currently, but we're hoping to write that case study up too. So everything from really, really tiny people, all the way. I mean, I had a patient with, she had something called scleroderma. She couldn't empty her bladder completely. So she had chronic bladder infection. She was 83 years old. And the Biocidin LSF, because it was outside the gut, right? And she was getting biofilms on the catheter, of course. So she had a naval catheter. And then you wouldn't believe the way that it improved her quality of life, because she was able to discontinue the ongoing use of prophylactic antibiotics using it. So it's just amazing to watch your patient's quality of life improve with the product.
Wow. Diane, I don't know about this for multiple sclerosis. I'm assuming is MS, what you're saying here. I don't know. Do you have any? Well,
MS can have a trigger of, dysbiosis in the gut. I know it's really commonly linked to candida overgrowth. So whether it's the Biocidin or some other form of balancing the microbiome, it's a really imperative part of treatment for any autoimmune condition. And I know specifically for MS that candida can play a pretty large role. So that's a fungal element, and it's something that we've got research showing clearance of fungal biofilms. And it's something that could be potentially helpful. Yes.
Sure. I don't think it would hurt, for sure. It could.
The one thing I would say is that with anybody with an autoimmune condition, especially if they're in remission or if they're not, or is that you have to be careful and work with someone like Dani that can help counsel you on how to work up carefully and slowly so that you don't aggravate an autoimmune condition. And so that's the piece that's really important, is to make sure that you have a practitioner on board who's well-versed in the use of the product and how to support your body as you work up, so that when you clear biofilms, we think this happened to me. So I did this on myself. I thought, I'm going to go after candida when I first time I used Biocidin. And I started taking the Biocidin liquid, and all of a sudden I had a full body mold toxicity recurrence. And it was because it's because the mycotoxins, or the toxins from the mold, were holed up in biofilms in my body. And when I cleared those, all of my symptoms returned, and then they went away again. So gratefully, I clear things quickly. And so it was only, less than a week that I had sort of a relapse. But because of that, when you clear a biofilm, you're looking at heavy metals and oxalates and LPS, as you mentioned. So these are all toxic metabolites and other microorganisms that your immune system may not even be aware of currently, because it's hiding behind the cloak of a biofilm. So right. It just has to be done in a way. And that's actually, we could talk about the GI detox, because that's what this product is designed for, is to mop up all of that toxicity that gets produced by those bugs in our body. And it can, it's not going to just absorb that. Just like the Biocidin liquid, it's a very broad spectrum, and so it binds lots of different things. But this product can really help people who are sensitive keep from having a reaction to the product, because you take the Biocidin, you take this later, and it mops it up so that your body, it holds it in your gut so that you release it in stool instead of reabsorbing it and having to process it through your body and your liver, and potentially generating inflammation in the body. So I didn't know how to use it when I first started using it. That's why I created this problem for myself, but I learned it the hard way, right? But I did learn it.
So if we have sensitive patients who tend to react to everything or have some sort of reaction to things, this would be something great because what GI detox is, guys, it's bentonite clay and it's zeolite clay. And it's not bentonite, it's activated charcoal and aloe vera and apple pectin and fulvic acid, there's multiple things in here.
Yes.
Buying too. This helped. My son went to Southeast Asia by himself 2 years ago backpacking, and he got so sick in Bangkok. I mean, really sick.
Oh, boy.
I think the kid only got out of Bangkok because of GI detox. I mean, he was so sick. I mean, I told him, I said, well, get it out of you and as much as you can. And then take this, and it really helped. I don't know if it's really indicated for something like that,
no,
but
it's a perfect use for it. I mean, like I said, I can't make any claims, but I will say we've got lots and lots of reports, and I can report personally when I was in Peru and got a bug that product line, or that product in particular, will really relieve a lot of gas and bloating and discomfort in the gut.
I wouldn't travel anywhere without this if it was me. I think this is a great thing to keep in your suitcase for sure if you're traveling.
Where sensitive patients are concerned, there are a lot of us practitioners, I think, especially sort of the longer we're in practice, if we start to see more and more complex patients and those very, very sensitive patients. Yes. And there are a lot of patients who will do really well just starting with the GI detox, just for a week or two before you even bring in any of the antimicrobials, to start to bind up some of what's already going on there. And then they might tolerate bringing in the biocidin, and you might start with 1 drop a day, if you're trying to, and often those people will clear the gut first with the liquid and then move on to the liposomal if you're doing more of a systemic clearing. Say mycotoxins hole up all over the interstitial tissue, right inside the cells in our whole body. So
I use this with a lot of my Epstein-Barr patients as well, and it seems to work really well.
That's the liquid biocidin?
Mm-hmm, the liquid. Mm-hmm.
Okay.
It does.
And you might consider supplementing that with the Olivirex too, because that's
let's go straight to Olivirex then.
So the Olivirex is again a formula, and that's Rachel's sort of genius is in the development of these formulas that work together, right? And so olive leaf has a lot of research behind it, specifically for addressing viral concerns. And so if you have, it can really bring in, especially, so actually, Dani, I would do this combo, right? So maybe you clear it with the gut first, you work the gut first. And then once you've done that, then you want to do systemic, and we think a liposome is going to go intracellular, and viruses are intracellular pathogens, right? So I would tend more towards this one, at least a round or two of that.
For Epstein-Barr, we're talking.
Anytime that you're trying to get inside the cell.
Okay. Got it.
Be really careful.
So tell them what's in this Olivirex.
So the Olivirex is primarily a very high potency olive leaf. The active ingredient in this is called oleoropin. It's really studied as an antiviral herb. And the oleoropin is combined then so Dr. Fresco is an acupuncture and oriental medicine, and she's combined in this formula to help with drainage, it's called. So where you're moving toxins, and you also move the constituents or what's in the product, the medicinal herb, through the channels as well when you do drainage. So then it drains liver and kidney as well. So people do, or it just helps to move it into the therapeutic areas that you're looking for. So nice combination formula, and olive leaf, very potent as in its antimicrobial activity, not just viruses, but that's why. So for my complicated, like a SIBO patient,
yes,
especially the methane producing SIBO, then I would always combine the two of these together because it's a much stronger hit to the microorganisms. And the cool thing is too, this is one of the studies that we have going on right now, is that the biocidin liquid we have with Sun Genomics, we're doing before and after testing, because the question that we get the most often from our practitioners is, well, what about the beneficial microorganisms? Does it wipe out the beneficial microorganisms in the gut too? Because we need those good guys, right? And the answer is, it appears that it does not. In fact, not only does it not diminish it, but in 6 out of 7 of the people that we've got back so far, there was actually an increase in something called Akkermansia. You know Akkermansia, yeah. I'm sure you do, right? So Akkermansia is it's a keystone species. It is known for helping something called metagenomic richness, which means that it helps all of those other beneficials establish themselves. So not only are we not wiping it out, but we're actually increasing some of these beneficials, which is a pilot study right now. So it's not published, but we are working on moving into publishable research with Dr. Raja Sivamani if you haven't had him on, you got to have him on. He's great. He's
I have not.
super brilliant guy. But we're working at, he's at the Pacific Skin Institute, and we are working on getting together a clinical trial in order to be able to publish that data showing an increase in beneficials, or at least not wiping it out, right? So we have lots of history on, do you know that we were on, it's Genova now, but it was Great Smokies Diagnostics. We were on their stool panel for 250,000 stool tests.
Yes.
Yeah, that's where we really got, it's why we're known as a gut company, even though we're talking, we have a whole body and lots. But you and I know, and I think that the whole world is starting to know that the gut function and gut health is so important. I mean, even there's a gut brain axis and a gut lung axis and a gut, so it's so important, of course. But it is, we've got a lot of research under our belts, which is why I get so excited. Can you tell?
I know you do. This combination is a great combo for. There we go, right there. For your immune system as well, because I was just reading in here in your book, of course, combining these two, which would be Olive Rex or Olive RX and the Biocidin throat spray. Yes, somebody just said talk about the throat spray, and then the dental Sidin, and then I want to talk about ProFlora. I love ProFlora and I love the Biotonic. This is mine. I would take it right now, but I'm afraid it'd keep me awake. I love this Biotonic.
Oh, that is awesome.
I don't know if I use it right, so that's what I would like to know. But let's talk about this throat spray, because they seem to talk about this every day, basically. And I spray this thing all the time. I probably overdose on it.
Well, gratefully, it's pretty benign in terms of it would be hard to overdose. But so the throat spray is 40% Biocidin liquid and 60% alcohol. So that's what's in it. And initially that was done in order just to get it thinned out so that you could direct it at the throat, right? But when we did the research, so this was independent research. We didn't have any idea what was happening the whole time that they were doing the research. But then they came out. This is, I think it was University of, it was a college in Alabama, I think, but I'm not sure. I can't remember. But it was college athletes. What's that?
Is it a good old Southern school?
Yeah, that's right. Good old Southern school. So they, on college athletes, they work out so hard that it causes immune system suppression.
Yes.
And so what they did was take college athletes. They had a placebo, and then they had a group that took just the Biocidin liquid, the drops, and then they had a group that used the throat spray. And what they found was, so they swabbed the mouth and they looked for immune components called IgA, which is an antibody that is our first line of defense against anything that comes into our nose, our sinuses, our mouths. And they saw that it was suppressed in these students, and then they used the throat spray, and against placebo, the students who took the Biocidin liquid had a 66% increase in 30 minutes of the IgA. And when they tested at 60 minutes and 90 minutes, that was sustained. So what we can say is in these students, it lasted an hour and a half. So when I'm concerned about seasonal wellness, I use this product every hour and a half. That's when I'm going out and about. And then because olive leaf has this sort of its own research on as an antiviral, that's why it's a really nice combination for seasonal wellness and any sort of viral concerns.
And what do we have going on right now in the world? We have a virus that, who knows? This certainly won't hurt you, could protect you. That's how I tell patients. They're like, well, is it going to, prevent it? I go, good Lord, I don't know, but it's good. Hurt you.
Right.
For darn sure. Anytime I go to the grocery, anytime in between patients, I'm spraying it again every single time. And so far, knock on wood, I have had no sniffles or snorts or anything going on this year. But I think it's extremely well priced, guys. I think it's $24 or $25. I don't know. It retails for $24 or $25. And it lasts forever, and it works beautifully. And if you can raise your IgA, which is your immune system, I mean, that's what we need right now. So I think that this is a phenomenal product right here. Yeah.
Well, thanks for your vote of confidence, because I feel really passionate about it. But it is, I mean, especially around that particular issue right now, you know, it would be great if we could get a study done, but we haven't done that yet. So,
and it's also great for allergies. What I've noticed for me is my seasonal allergies were less in spring this year. Now, it could have been multiple reasons. I was raising tons of vitamin C. I was doing lots of things in March and April. But
yeah, we all were.
I think it works with allergies as well. So I'm a big fan of that. Just throwing this in your purse. And like I said, it works beautifully.
It makes sense that it would help with allergies, right? Because IgA, when it gets lower, our body responds by increasing IgE, which is sort of what mediates allergies. IgE and IgG go up. So that's why it's such a nice immune modulator, because we don't want our IgE and IgG elevated if we can help it, right? We want that IgA in there taking care of business before we have to raise those other antibodies. And that those, you know, the IgE, we're looking at allergies, the IgG, we're looking potentially at inflammation and autoimmune conditions. And so it's really nice. That's what's so nice about having an immune modulatory product, right? Is that it helps balance immune function. And so, that's what I love about it.
Well, then if we're going to talk about balancing, well, shoot, we might as well, because somebody want to get to dentist. But when you talk about balancing things, adaptogens that work like adaptogens, I love this adrenal tonic.
Talk about Biotonic. So the Biotonic is again, I love that product too.
Tell us about this, because this is probably my least sold one in there, and I don't know why, because I use it every day. So who would use it?
Well, so Biotonic, I love it for those chronically ill patients and very sensitive patients with low vital force. So I'm a naturopathic doctor, and we talk about the vis, which is our vital force, right? And so people who have fatigue, who get sick and can't kick it, or who just are feeling like their vitality is low, then I think of something to support, and adaptogens will help those. The purpose of an adaptogen is to, again, support that, bring that vital force up, and help us adapt, right? So that's why they're adaptogens, right? This particular product is mostly Chinese herbs. It was, again, developed because Dr. Fresco has that acupuncture and oriental medicine background. It's a combination of two different formulas. One is to support immune function, and the other is to support qi. Which again is that vital force. So the combination is really nice, especially, I think if you're seeing a lot of those chronically, like the Borrelia patients, mold patients, those patients often could use that extra additional support. So that's where I find myself using it. The other thing that is in this is Artemisia annua, which is it's a wormwood. And it's known again as another antimicrobial. It's used specifically traditionally for parasites.
Yes.
And it also prevents the growth of hyphae in yeast and mold. So hyphae are these little sort of projections that come out of yeast, and it's how they anchor themselves to our connective tissue. So if they get in and they anchor themselves into our gut or our oral mucosa, the esophagus, that's when we see things like thrush. And so that's a nice, it's a nice use, additional use for that product as well in the combination. And so I see the question from Pamela. Yes. So the first product that I would look at for thrush would be Biocidin liquid, and you might consider bringing in the Biotonic as well. And so the Biocidin liquid for thrush, especially in babies, the Biotonic is a higher alcohol content, and it can't be used for children under 7, or it shouldn't be used for children under 7. So especially thrush, primarily we see in children and immune compromised people. So if you're talking about a child, then I would stick with just the Biocidin liquid.
Okay. I never thought about Biotonic for thrush, but yeah.
It's nice. I mean, especially you think about someone who's immune compromised.
Yeah. I think it's fabulous. I've used it. I mean, I have lupus and have since I was in my 30s, and just have a lot of stress with the business, and then my mom in the assisted living and struggling, and it's got eleuthero in it, eleutherococcus, which I consider great for people under long-term stress.
I love eleutherococcus. Yeah.
businesses and bad marriages,
Oh my goodness.
jobs, all the things that can happen long term. So yeah, I love it. And I haven't had anybody react to it or anything or say that, they had a bad reaction to it. I think it's fantastic. It's my new go-to for adrenal stuff for sure.
That's great.
Past year. Yes, ma'am.
I'm happy to hear that. We do have a case study too. So this is my own patient, and I have before and after testing using, what I used was the Biocidin liquid and the Biotonic for Giardia. So what I had, it's the only thing she did, and we had the gastroenterologist doing the testing. So that was exciting to see that. That's the first one that we're going to try to publish, just because it's so straightforward. It's not controversial. There's no controversy around Giardia currently, but it was a pretty amazing to see. Oh yeah.
Brenda, is there help for thrush is the same to eliminate candida? Yes.
Yes. They're the same thing. Yes. A thrush is a candida overgrowth in the mouth.
Yes, it is.
Okay.
But so if you have something in the mouth, this I love right here. And I think I've got my dentist on board now.
Nice.
Yes, for both of these, but I never really know exactly when to use this one for sure. But talk about this toothpaste and what's in it and why you would use this. Would you use it every day? Because here's the thing, people, you all know I'm all concerned about money always as a single mom. This is not cheap right here. This is one of those things that's a little pricey for sure, but dang, is it unbelievable.
Right. And the nice thing about it too, I think, is that so everybody's already brushing their teeth, and so many of our patients are already taking so many supplements, right? And so this is a place where we can start to affect change in our entire microbiome just by treating in the mouth, right? Because we have what's in our mouth, we swallow it and it goes to our gut. And there's research showing people who brush their teeth regularly have lower levels of candida or yeast in their stool. So if we can work at balancing the microbiome here, it's going to eventually help with establishing a healthy microbiome in the gastrointestinal tract too. So it's a great combination in that way. And it's nice not to add another supplement to the load, right? It's a nice. So, and what is it? It's a Biocidin. It has one bottle of Biocidin. Let me think about this. I think it's 20% Biocidin and liquid. And then the rest is a natural toothpaste base. It's fluoride free. It's preservative free. So the Biocidin stabilizes it, so it doesn't need a preservative, which is very cool, of course, I think. It has a mint flavor, so it tastes good. Kids don't mind it at all.
Oh, no.
And so it's just
amazing.
And even we have even one of our people on staff, her daughter was having dental caries every visit and stopped having dental caries, which is cavities. I forget who I'm talking to.
You're ready to tell it. Yeah.
When she started using this product, and she was eating a healthy diet and had great oral hygiene, and this was the only shift that really changed that for her. And so it just depends, right? So it was most likely a microorganism that was growing in the mouth that when she used the product, because it has that biofilm or plaque busting activity and the antimicrobial effect. And I mean, there's so much science here that's really, I totally geek out about the science on it. It's so fascinating because when we have plaque, our immune system comes in and fires away at the plaque, but it's not effective against it. And so instead what you get is inflamed, and that's periodontal pocket. And 70% of people over 30 in this country have some degree of periodontal disease. Mm-hmm. And that periodontal pocket becomes a place where we get all of this inflammatory mediators directly from that periodontal pocket into our bloodstream. We can re-inoculate to the gut. And so it just becomes very important. I wish I had known more about it when I was in practice. One of the best things about being the director of clinical education for this company has been that I've been able to get paid to do the research that I loved doing before, right? And I have more time to do it because that's what they want me to do. They want me to be, to learn and to be able to help bring forward why, more information about why this product is doing what it does and why it's effective. And I've learned so much in the last year, really doing a deep dive on oral health, or the relationship of the microbiome to cardiovascular disease, or now to lung health. I'm sorry, I'm off track, but I just get so excited.
Okay. It's okay. So this would be great, but then when would you use the liposomal?
It's a great question. So it can be used by anybody that's using an oral rinse already. It is the liposomal biocidin, right? So the difference is that we have the liquid, which again will stay sort of local wherever you use it. And then there's the liposomal form. And that one is going to get tissue penetration, better tissue penetration. So if you think of someone with deeper dental concerns, say cavitations, root canals, periodontal disease, then you want to try to get there by using a product that's going to access that space better. Does that make sense? So you can use the two of them together.
Oh, I've had patients use this after oral surgery. They just report unbelievable things with this right here. Or if they have sores in the mouth or something. I've never really had a whole ton of dental issues. But okay, so if we're going to keep it right in here, we would want to use this, correct?
Right. If you want to, I think of the toothpaste, which I don't have mine here, but the toothpaste I think of more of as like, plaque and cavities and that sort of thing, versus the oral rinse would be like people who have more deeper oral health concerns, right? Like periodontal, or root canal concerns. And we do actually have a pilot study on the liposomal form clearing pathogens in the mouth. So clearing the harmful organisms in the mouth. And we are hoping to get publishable research on that as well. So.
Well, I'm telling you, this is the root. If you don't have good oral care or oral health, well, oral care as well. But one of the first things that people stop when they go through hardships, right, or they lose their job or what have you, they don't go to the dentist and they don't go to the eye doctor, and and your oral care is so important. Your oral health is, it's directly related to your heart health, and the number one killer of men and women in the United States. Well, it's cardiovascular disease, right?
And I think people right now, especially, are avoiding dentists and eye doctors, right? And so only doing things that are absolutely essential for the time right now. So I'm sorry I cut you off, but
No.
And also, I get excited.
So they only have 10 products, and I knew they only have a limited line. I didn't realize we have all 10. I have all 10 products in my office.
That's awesome.
And this is the newest one for me, which is Proflora. And I'm going to tell you what, guys, you all know I'm a huge fan of a spore-based probiotic, right? So you've watched Karan on here. Karan was amazing talking about gut health and immunity and all that. That's Megaspore. So this is the same spores. The spores are the same. Am I correct on that?
Yes, we licensed the Megaspores products. Yep.
That's correct. But this has added, which I can never say it correct, quercetin.
You said it perfectly. Quercetin, yeah.
Pretty good for a girl from Gilbertsville, Kentucky. Quercetin, marshmallow, and aloe vera. Am I right? Did I have that right?
You said it perfectly. It's amazing.
Well, so I have been using a tremendous amount of this right now with COVID-19, right? Just doing everything we can to boost the immune system up, and tell me why you would use this. I need to shut up. You tell me.
Well, I love hearing your uses on it. I've learned so much from practitioners and their experience with the product line. So I'm happy to hear you talk about it as well. So just to be clear, Megaspore has 5 different bacillus strains, spore-forming strains, and this is 3, right? And so we took 3 because the other 2 strains, biocidin and the rest of the product line, really cover the activity of those strains. And so we went with those 3 strains, or Rachel went with those 3 strains. And then it's just, again, it's that supplement load for people. So instead of having to take a probiotic and something to stabilize inflammation and something to heal the gut, you have all in one, a capsule. And so quercetin, antihistamine, has a lot of research showing it works as it's effective as an antihistamine. And mast cell stabilizer, and then and it's just a potent anti-inflammatory. And I can't go into it in great detail, but inflammation is playing a huge role in people at high risk right now.
You bet.
And so that's an important piece to consider as well. And then the aloe and the aloe and the marshmallow are what are called demulcent herbs. That means that it's like putting salve on your skin. Like if you get a burn, you put salve on it. Those herbs will help kind of coat and heal the lining of the gastrointestinal tract, or support healthy mucosa in the lining of the gastrointestinal tract. So that combination is a really nice all in one. It's amazing to me to take one capsule, and that one has made a huge difference in my allergies, my seasonal allergies. I think it's both the bacillus strains and the quercetin for me, I think, have really made a difference.
There's something special about this quercetin, but I can't remember what it is. It's like really
bioavailable. Yeah.
Bioavailable. What is it? I don't know.
The form of it is called QU995, and it has in studies 170%, so 1.7 times, so almost double the absorption into the bloodstream. So they did blood testing. So it's basically almost like taking double the milligram dosage, and we know that it gets into the bloodstream and where it can do its activity there. So it is really, and actually that 100 milligrams, that's the dose that's been studied to heal the tight junctions in the lining of the gastrointestinal tract. So if you are concerned about leaky gut,
gut, okay, those are your tight junctions that open up, right? They just wiggle apart through decades, or not decades, so many decades of stress and not chewing your food, and gluten and viruses and bugs, things like that. And that's what those are a few of the things that create that leaky gut. So it can help close those tight junctions.
Yes, that's different research. That's not our research, but there's clinical, or there's I don't think it's clinical. I think it's I don't know. I'll have to look at the research, but there's published research showing that dose helps to heal the tight junction.
You take your spores with food, which is a little bit different than most people take this with a meal, correct?
You can take it anytime.
Oh, you can't.
The only thing you need to take it far away from is the GI detox. That's true for everything. The GI detox, because it absorbs everything, it will absorb medications. It will absorb. So it needs to be taken.
Do not take it anywhere near your thyroid medicine if you're a patient of mine, because it will cause me to go into a tailspin when I get your labs back.
Yes, exactly.
Go through the roof over there.
Exactly. So, I mean, and I think about things like blood pressure medications and psychotropic meds like this. It's really important that you take the GI detox away from everything else, an hour at least. But the Proflora, actually, Tom Bain, who owns Microbiome Labs with Kiran Krishnan, he put the Proflora in the biocidin and it didn't kill it. So you can take them at the same time if you want to, which is again so nice. And when you're thinking about just compliance, like the ability to take everything, it's so complicated when you have to have like scheduled out 6 different dosing times in the day, and it's so nice to be able to just take it all at one time and be done with it instead. So.
Well, I agree with you. And I tell you what, I know one other thing that I wanted to ask. Why would you use the capsules over the liquid? Because I hardly ever sell these as much, because I always promote this. Just they can't tolerate.
I'm so glad.
Okay.
I think you're doing the right thing. So the reason that you're doing the right thing to me is because when you use the liquid, you're treating in the mouth also, right? And so you're getting this other therapeutic area. And then the esophagus and the stomach, when you swallow a capsule, you miss this whole area. So the only time that I use the capsule is if someone's traveling, then and they don't want to carry a liquid, then they could bring the capsule. Some practitioners recommend using them as suppositories as well. So potentially, I'll let your imagination run wild with that one. But that's
straight up without really
vaginal, rectal suppositories, depending on what you're after. So those are the only times really that I do, or if I have a really picky patient who doesn't like the flavor of the biocidin, but that almost never happens because it's palatable. I think it's palatable. I always describe it.
Do it, for crying out loud.
That's what I say.
That's what I say. Just
buck up and take it.
So if we're gonna, so just the average person, say somebody says, I don't have a leaky gut, which we know that's not true, you do, but I'm fine. I just want to boost my immune system, which I don't get those patients. I wish I got those patients in the office. Dani, just check my vitamins. I feel fine. Just a basic thing. What would you do if you just had a patient who came in and said, I just want to boost my immune system? That's all I want to do.
Okay, if I have people, I had a small pharmacy, and I did have people who would come in and say, I just want something in my medicine cabinet for immune support. So if I start not feeling good seasonally, what can I do to help support that? And that's the throat spray, hands down, right? Number one for me. And then the Olivirex. So that combination.
That's what I grabbed. So there we go. Good.
You did it.
See, guys, I'm not a total goofball. Okay.
And then yes. Yeah. And I think, that's for someone who's feeling really, really feeling well and just wants that seasonal sort of support. For a lot of people who are, and I think you were kind of touching on this already, right? Which is that if your gut is not healthy, your immune system will not be healthy either. So ultimately, making sure that you have good gastrointestinal health, because we have around 80% of our lymphatic tissue, our immune system, in the lining of the gastrointestinal tract. And if it's not healthy there, it's unbelievably cool to me. And again, I'm not really geeky, but I know it's almost time for us to be done, but I thought this was so interesting. I was reading about the gut, or just the immune system, respiratory health, sinus health. And there's research showing that when we inhale something into the sinuses or the mouth, that we swallow it, it goes to our gut, and the lymph or the immune system in the gut reads it, and they start to produce like a little army against it. So this is a reason to swallow your snot. No, not really. Don't swallow your snot. But it's when you get the post-nasal drip, right? And it's coming down, and there's a purpose for that. Our bodies know what they're doing, right? So that goes down into the gut, and the body basically starts to build an army. The immune system in the gut starts to build an army. And then if you end up getting a respiratory infection with that virus or bacteria, then the lungs actually send messages to the gut saying, do you have anything for this? And if our gut is healthy, it recruits those cells from the gut back to fight the war that's going on in the lungs or elsewhere in the body, systemically. So unbelievably complex and beautiful what our immune systems are doing. And again, it comes back to that. It's why we keep finding the gut kind of fill in your organ axis, right? Gut brain axis, gut lung axis, gut, all of that. It's like, it's just so much of what we think about it, like this is where we get exposure to the outside world, really. Even though it's in our body, it's where our body does what it needs. It reads what's coming in and manages it. And we need just the right amount of immune response. We don't want to get too immune because we don't want to be reacting to everything we eat or everything that we come in contact with. So we need that tolerance as well. So making sure that you support the microbiome in the gastrointestinal tract plays a huge role in that. And that's what they're finding, is that it's now the microbiome gut-brain axis. It's not just the gut-brain axis. It's what's living in the gut is vitally important for the gastrointestinal health in general. And nobody disputes that anymore. We all know that.
Isn't that something? And I wasn't taught that in school. Now, you probably were because you're a naturopath, doctor. I was traditionally trained nurse practitioner, and they didn't teach me any of this. Not the first thing. I had to learn it all on my own. And it is maddening to me that I've spent the last 10 years unlearning. Now, I learned traditional good stuff. I mean, how to save people. I mean, pharmaceutical wise, and there's a time and place for that. So I'm not doing that. But I've had to unlearn so much of what I learned.
Yes.
And fantastic. I mean, that's fantastic. Good. But you mentioned something about nasal. Can you use this? Could you dilute this and put this like in a neti pot? Can you use this nasally or no?
I can't make any recommendations, but what I would say is that there are practitioners who use the LSF would be the better choice because the liposome will emulsify evenly. into a nasal spray. And so you'd have to use it quickly enough that there's no, it just has to be used up relatively quickly. So you don't want to create it, then stick it in your medicine cabinet and then use it a year later. I think it has to be used within 2 weeks or something once you add it. But yeah, there are some that will, or neti pot is another one that some practitioners use.
Okay. Yeah. I didn't know that because I'm all about wiping out stuff in the nose right now and the throat and just trying to protect anything that's viral right here. So I didn't know that. That's a good idea. That went by so fast.
I know. I feel like there's so much more we could talk about.
I know we could talk forever. We'll have to do a part 2. If you guys want a part 2, you need to hit your heart buttons over and over and over here. And because we could definitely talk about so much, but I want to be conscious of your time. But guys, here's the bottom line is you can take all 10 of these products if you want, right? You can do it, but you can't out supplement an inflammatory diet. It is as simple as that. There's not enough biocidin in the world to fix a processed, bagged, canned, fake, man-made, somebody's feeding you out of a drive-through window diet. I'm sorry. You know this. You've got to eat well, sleep well, move well, poop well, decrease stress, and you need community. And I think right now we are the hearts are going everywhere. They're wanting you to come back, by the way. So I'm sitting here watching it on here. You've got to eat well, sleep well, move well, poop well, decrease stress, and you need community. And we are desperate for all of that right now.
Yeah, I couldn't.
These are supplements, but these are way more than supplements. I'm a huge fan of Microbiome Labs. I'm a huge fan of you guys are the only 2 supplement people that I've had on here because I think the integrity of you hands down further than superior to everyone. And
that's so nice, Dani. Thank you.
Well, it's true. It's true. And I think that yes. So guys, I appreciate you all, but listen, next Sunday night, and then we'll have Dr. Strand say the last word. Next Sunday night, there's no Sunday night service. It's it's Labor Day. Crying out loud, it's almost Christmas. I don't even know what happened to the year. No Sunday night service. What was I going to say? Oh, but guess who is coming on September 13th, which will be the next time? Dr. Nasha Winters, who wrote The Metabolic Approach to Cancer. Guys, if you don't know this book, if you want to just read a book to help maybe prevent cancer, right? Or if you have cancer, or if you've had cancer, if somebody has cancer, this is an unbelievable book. And Dr. Winters is actually a naturopath doctor. Do you know?
I'm going to write that down. No, I haven't.
Oh my goodness. She is brilliant. And she'll be on here on September the 13th. I don't know where she went to school, but she does all naturopathic oncology is what she does.
Wow,
she is
very cool.
She had stage 4 ovarian cancer, and she was told she would not live. So she works with the sickest of the sickest, and she's agreed to be on here. I just emailed her out of the blue, might as well, and she just sent back, well, I'd be thrilled to. What?
I can't wait. I'm going to watch. I'm putting it on my calendar.
It's exciting. So anyway, that's what's going on, guys. Come see us. This week is our 6-year anniversary at Integrative Family Medicine. So September the 2nd, which will be, I think, Wednesday, I opened up to the very first patient 6 years ago. So that's exciting here. But Dr. Strand, I'm going to tell you, you did your company well tonight.
Oh, thank you. That means a lot to me. It really is an important mission for me in the world. And I also just want to agree with you. I think I tend to get so wrapped up in the science of everything, but it's so important. All of this other lifestyle things are so important. And, good sleep and community and diet and all of that. Like that, you can't get anywhere without addressing that stuff first. I agree 100%. So this is more of an adjunct to a healthy lifestyle as well, to get that therapeutic effect. So I love hearing that.
They're supplements, not substitutes. But and I tell people that every day. And they also don't work in the bottles, people. You have to take them. If you're willing to spend the money for these things, then you must take your vitamins and take the supplements. It's just maddening to me. They'll come in with their big old bag of stuff. And I've seen them 6 months ago, and they still have a bottle that has 2 months worth in it, and they shake it and there's still a bunch in it. I'm like, well, you've been doing the other 4 or 5 months. You know, it hasn't even been used. So they don't work in the bottle, but you definitely have to get the diet right first, and the exercise and all those things. But guys, I appreciate you being on here. Any questions? It's Pamela, it's integrative family medicine, not integrated family medicine. Integrative. Everybody always says integrated. Yes. Yes, Jill, thank you so much. She says, thank you for all the great info. And guys, we have all of their products on our website. So you can just go to our website and click Integrative Family Medicine Supplement Store, or you can come in and see us, or I don't know where else you can get them. I know those 2 places.
Why go anywhere else?
Well, that's exactly right. Why go anywhere else? But Dr. Strand, thank you so much. And for all the work you're doing. I can't wait to see what else you guys have in the pipeline.
Thank you. You know, I can't wait to tell you about the other research that we've got underway right now. We'll do that at some point as well. So
we'll do it.
All right.
All right, guys. Have a good Sunday night. I hope you meal prepped today, because tomorrow is Monday, but next week is Labor Day. So it's a short week. So that's good. But you better be meal prepping. If you haven't, you better get in there. It's only 7 o'clock Central Time. You got to meal prep, because you cheat when you're not prepared. And I don't know about you all, but I'm not cheating over there with salmon and broccoli most of the time. So get out, go meal prep, get to bed early tonight, get up tomorrow, get your feet to the earth, your face to the sun, and have a great week. It's going to be a great week. All right. Bye, Dr. Strand.
Thank you, Dani. Take care. Thanks.